I'm going to try and answer the so what, to the extent I can. But also I acknowledge that there's more that can be done. So thank you very much for that opening and the challenge. So for United Nations Population Fund, we truly believe that South-South Triangular Cooperation is a key development instrument that can contribute to achieving the objectives of the 2030 Agenda and also the African Union 2063 Agenda and other development frameworks around the world. We believe it's proven to provide unprecedented opportunities for developing countries to leverage both their own experiences, knowledge sharing, and resources in support of contextual, technical, social, and economic transformation of their own and other development and people. Particularly where I think SSTC is helpful is in respect of policymakers, program managers, and other duty bearers, like parliamentarians and religious leaders, to acquire the necessary best practices, the know-how, and be able to access relevant innovations to better adapt to population and development challenges, to improve the health, living standards, and ensure the equality of their people. So therefore, SSTC is important for meeting all the SDGs and other development frameworks, and you're absolutely right about the issue of integration that has just been spoken about and a systems thinking approach. For us, particularly as UNFPA, we've been particularly focused on what it can contribute to SDG 3 on good health and well-being and SDG 5 on gender equality, while also understanding that the provision of sexual and reproductive health and rights contributes to the realization of all the 17 SDGs. We also included SSTC as a key component in our strategic plan of 2022-2025 and see it as an accelerator to trying to catalyze and turbo boost progress towards ending unmet need for family planning, ending GBV and all forms of harmful practices, and ending preventable maternal mortality. Specifically in East and Southern Africa region, we also see it as a priority for ending sexual transmission of HIV. I'm going to talk a little bit more about the kind of ways in which we've seen that SSTC can be that accelerator, accepting and understanding that it is within a context where indeed more needs to be done. So we work as UNFPA with continental and regional institutions, country governments, of course, and parliamentarians, civil society, human rights institutions, youth and women-led organizations and networks, academia, professional associations, private sector players. And in that work, we've been trying to infuse the SSTC as a specific way in which we can leverage on South-South partnerships and cooperation for mutual learning and identification of context-specific proven solutions, as well as ways in which those proven solutions could be taken to scale for better efficiency, effectiveness, and impact. So there are a number of examples of this that I just wanted to put on the table. In respect of one of the key areas that UNFPA works on, and which actually was mentioned by Professor Dube. Is this Professor? Is it Professor? Zulu. But it is Professor Zulu. Professor. Mr. Zulu. Yes. Dr. Zulu. Yes. You spoke like a professor, sorry. By Dr. Zulu. Aspiring. Aspiring, okay, so I'm speaking into your future then. So Dr. Zulu talked about the demographics, and of course that's one of the big things that we work on. And in that work we really focus on data, population data particularly, and how population data can enhance evidence-based decision-making. So with the joint financing through SSTC, we've seen we can significantly reduce startup costs for programs, particularly when technology that is both soft and hardware is readily available for sharing. This is often one of the impediments for governments to regularly undertake these exercises. So recent examples of such SST initiatives include the knowledge and technology transfer for the 2020 population census round in several African countries. Facilitated by UNFPA, several countries benefited not just from peer learning through knowledge exchange and technology transfer, but also from actual exchange of sharing of hardware, such as the census tablets. For instance, at the end of the Malawi 2018 census, 15,000 tablets were procured by UNFPA, FCDO and DFID funding, and they were transferred to Zambia for their 2022 census. Similarly, government-to-government arrangements happened in several other countries with support of UNFPA. So Kenya shared its tablets with Mauritius and Sierra Leone. So we're also talking across regions, not just within the same regions. Togo recently shared with Namibia, and census taking is currently in progress in Namibia using what was shared by Togo, and significantly reducing the startup costs for census planning and implementation. Also, senior members of governments from Kenya, including members of a parliamentary committee for population and development, went on a peer learning to Malawi regarding planning for the 2019 Kenya census. Experiences gained from that exchange led government to allocate 98% of the funding for the census, including procuring 150,000 tablets, some of which were then given to other sectors under the SSTC. In another area that we work on, which is about facilitating country exchanges for that issue of identification, documentation, and scaling up of context-specific differentiated solutions, UNFPA continues to support the country exchange visits. So, for example, in 2022, we supported a South-South learning exchange between the government of South Sudan and the governments of South Africa and Ethiopia. And it was interesting because I got to see both the beginning and the end of this exchange. So when South Sudan visited South Africa, I had an opportunity to meet with them before they'd even started their visit and to discuss what their hopes and aspirations were. And it was a group, a multi-stakeholder group from South Sudan made up of government, young people, women, and different ministries that came to South Africa and Ethiopia to learn from them, particularly in the area around gender-based violence, looking at issues around how to set up shelters, helplines, etc., and how to not just establish them, but manage them. After that visit, the South Sudan team learned some valuable lessons, and I had the privilege of going to South Sudan several months, nearly a year later than that visit that they'd made to these two countries of South Africa and Ethiopia, and to see for myself evidence of how they had integrated the learning they'd acquired into the work they were doing in response to gender-based violence in South Sudan. So it's not even about countries with the same, you would not think they have the same context. One is generally a conflict-affected country, and the other is a stable middle-income country. But the lessons can still be applied, and they were able to take some valuable lessons from that, and were improving their gender-based violence services as a result, and establishing their own shelters and safe houses. I think also for the South Africa delegation that hosted the South Sudan team, it also supported their thinking. So as that exchange happens, technicians and everybody asks questions of each other, which leads to greater thinking about what could be the next round of improvements, even to the services they're providing at that particular moment, particularly in some of those low resource contexts within a context like South Africa, which has both upper and middle income context, but also low income contexts existing across the country. Additionally, UNFPA continues to facilitate South-South learning on issues such as midwifery education, which we think is absolutely fundamental, to ensure that no woman gives birth without having a skilled attendant attending to her, reducing, of course, the issues of maternal mortality, but also morbidity, and looking at midwifery education, regulation, practice, and on provision of rights-based family planning services, where health practitioners begin to understand that this is a right and not a privilege that they're according to the citizens of the country and the clients that they're serving. Currently, UNFPA is supporting multiple field visits to different health facilities by different countries to learn about maternal and perinatal death surveillance and response, in addition to a trip for health managers from Southern African countries to South Africa to learn about confidential inquiry into the maternal death system. Last year, UNFPA, WHO, and UNICEF organized a multi-country visit in Kenya to one of the largest learning hubs in East Africa on essential care during labor and birth. UNFPA also continues to support transfer of essential reproductive health commodities from one country to another to avert stockouts and promote peer-to-peer collaboration among countries in strengthening supply chain management systems for sexual and reproductive health supplies, and in strengthening human rights and gender transformative approaches for improving sexual and reproductive health and the realization of reproductive rights. Other examples in this regard, Eswatini visited South Africa to explore comprehensive condom programming that led to a national condom preference study in Eswatini and the development of a national condom brand and initiative. Uganda's Ministry of Health visited Namibia to learn about client flow design to support integrated care, including enhancing male engagement. And Botswana visited South Africa to learn about the She Conquers campaign targeting particularly adolescents, girls, and young women. So much is happening, but more could be done to ensure we close the loop and that the learning does indeed trigger and relate and transfer into scalable initiatives that are taking place in the countries where the learning has been received. So I would like to highlight three key things as recommendations as I end. Firstly, to foster South-to-South collaboration and learning, UNFPA in partnership with others is planning to support regional What Works networks, because this is something of a challenge that I've encountered as I travel around and discuss with ministers of health and ministers of gender or women's affairs and young and youth. They want to know what works. Governments want to know what works. And we were thinking about, so how do we respond to that? So these What Works networks are really a way of enabling us to harness knowledge on what is working in particular areas, and whether those things could be packaged in a way that is easily able to be taken up by those who want to know how to do that and actually then put it into practice. So one of the areas we're looking at, because this is a key issue in East and Southern Africa region as an example, is teen pregnancy. Everybody wants to know what can work to reverse the trend on teen pregnancies. And I think there's a major political commitment in all countries by ministries of health that they want to see progress in this, linking with ministries of education and others. So we are establishing also a practitioners network on SRHR around self-care as another of the innovative solutions, because self-care has proven to be something that seems to be working.
Lydia,
we want to track it and ensure we make that happen. And the other third area is on data for development as a What Works regional network. So those are three: teen pregnancies, SRH self-care, and data. Anyone wants to join, please tell us, and we'll be happy to have you on board. Lastly, please share. We need to share more of what's proven and best practice that is actually working. Even if it's at a small scale, then we can look at how to scale it up. And then lastly, to create more awareness about SSTC. If people don't know about it, then they won't know that it's a tool that can be very useful and a mechanism that can be very useful. I think we need to go out and be talking more about SSTC, not just amongst ourselves, so that more join this movement. Thank you very much.
Thank you, Lydia.